So it's important to act on these two aspects, the bad behaviors and the faulty presumption. So just to come back on performance anxiety, it's sort of as if you take the example of a pianist that has to do a concert, if he feels really anxious and thinks things like, oh, I have to be perfect this evening, I can't make any mistakes, it has to be really the performance of my life, the person is going to feel so anxious that it's going to reduce the probability of giving a good concert. So it's sort of the same thing. The more anxious you feel falling asleep, the less probability you'll fall asleep easily. I want to say that insomnia is not a trivial problem. It has possible consequences. It can bring in the first issue for people suffering from insomnia is fatigue. We also notice the difficulties in concentration and memory that are mentioned by a lot of people who suffer insomnia. Impaired daytime functioning, we mentioned already. There is the data showing that insomnia, severe insomnia in a moment in our lives, will increase our risk of developing other psychological disorders like depression, anxiety, or substance abuse. We also notice that people suffering insomnia consult much more with their doctors, use healthcare services much more, and there is also a global impaired quality of life. So this is really an issue that we do have to study, to not consider that it's normal to sleep badly or to have trouble sleeping, and we have to really act on that. A few words now on the treatments available for insomnia. As you probably know, the hypnotic medications are those who are the most used in general population, but also amongst cancer patients suffering from insomnia. But although it is a quite efficient option, sleep experts agree now to say that they should only be used for a short period, never more than 4 to 6 weeks, because after that we'll see appear different difficulties. There will be side effects, for example, and what is most worrisome when we use these sleeping medications is that on the long term their efficiency is reduced and the person has to increase the doses to have the same effects. If the person doesn't increase the doses, they'll continue to use their medication, but the efficiency really is reduced. So the cognitive behavioral therapy that I'm going to present is now considered as a treatment of choice for primary chronic insomnia, for insomnia in the general population, and that associated to other health problems like a chronic pain or another psychological disorder, or in the case we're mentioning today, for cancer patients. There have been 5 studies up to now that have studied the CBT related to cancer, and these 5 studies were unanimous, showing that they were found effective in patients with insomnia to improve their quality of life and decrease the psychological distress. So this will really have a positive impact on the person's life. What is CBT? Well, it is a combination of strategies of behavioral and cognitive that will act on the 2 factors that I mentioned earlier, the bad sleeping behaviors and the faulty presumptions about sleep. One of the very efficient uh, uh, strategies is stimulus control. So the goal is to reassociate the bed and the bed environment with sleep. the bed, the bedroom, the time of going to sleep, and to reestablish a regular sleep-wake rhythm. So to resynchronize our biological clock. So how do we do that? We do it through very concrete strategies. There are 6 strategies. The first is to keep at least 1 hour before going to bed to relax. And this is to decrease our activation and promote sleepiness, so to reduce our agitation in the brain, but also in terms of our physiological functions, and to bring in sleepiness. What this means is that if we say, well, this evening I'll go to bed early because yesterday I slept badly, and that now you go to bed at 8:30 or 9 without having taken an hour to relax before, and we were totally active before, we just finished washing the dishes, doing the laundry, etc., then we're not in a favorable state of mind to fall asleep. In the same manner, if we just come back from an activity in which we were very active, whether physical exercise or some social activity with friends or others, and we come home and we go to bed immediately, the chances of falling asleep for someone who suffers insomnia will be reduced, because it's difficult to go from an intense active state to a sleeping state. So to keep at least 1 hour to relax before going to bed, to do relaxing activities like, for example, reading, watching TV, listening to some music, or doing relaxation. There are all sorts of different options, and they can vary from one person to the other. The second strategy is to go to bed only when you feel sleepy. And I'm going to explain the difference between sleepiness and fatigue. Fatigue is what we feel when, for example, we did some physical training. At the end of physical training, we're going to say, oh my God, I'm tired, my body hurts, I really feel tired. But the person who just did exercise might not feel sleepy. She won't feel that she's in pre-sleeping phase. She doesn't necessarily feel like going to bed after physical exercise. Whereas sleepiness are really all the little signs that we feel just before falling asleep, to your eyes close, you yawn, you have difficulty keeping your eyes open, etc. So ideally, you have to really wait for those signs before you go to bed, because that is really the precondition for sleeping. It's the same logic as saying if you're still active, either intellectually or physically, it'll be very difficult to fall asleep. The third strategy of the stimulus control is when you're unable to fall asleep or go back to sleep within 20 to 30 minutes, we recommend to leave the bedroom and to go into a different room. And that is to avoid spending too much time awake in bed, so that there's a negative association made between insomnia and the bed. We really want to have a positive association made between sleeping and the bed, not putting the so it's important not to spend too much time in bed while we're awake. We say 20 to 30 minutes, but you have to be careful to not be looking at the clock compulsively, because that could have a negative effect and make you even more anxious. So it's about 20 to 30 minutes. And actually people feel it as, oh, I'm getting agitated, I'm seeing that I won't be able to fall asleep. Well, then the best thing to do is really to leave the bedroom, to do relaxing activities, and to wait for sleepiness to come back before you go back to bed. And to repeat these as many times as necessary. If, for example, we have trouble falling asleep at the beginning of the night, wake up and only go back when you feel sleepiness, your eyes itch, your eyes are closing. And if after 20 or 30 minutes you're still not sleeping, you wake up again, you go back to do relaxing activities, and you only come back to bed when you really feel sleepy. And you can do that as many times as necessary within one night. Of course, the more the time goes by, and the less you'll have to go through the strategy, because sleep will improve gradually. And maybe the first weeks when you apply the strategy, you might have to do it a few times during one night. But as the time goes forward, you'll have to use it less and less.